What were your symptoms leading up to your diagnosis of cancer?
Well, the whole first day I was feeling fine. Got up and went to work early and worked pretty much the whole day. Left a little early because we were going to the Twins game that day. Met up with some friends downtown, and then about halfway through the game, in like the eighth inning, all of a sudden I couldn't eat my brat. I just wasn't hungry, and then that led to me having kind of like really bad sweats and a stomachache and headache. And I didn't think it was because I was drinking too much because I hadn't at that point. So I just started feeling really achy and sore, and I was sweating, and just was really uncomfortable. And then all of a sudden, I got this really violent. I just was really sick to my stomach, so I ended up throwing up twice at the game. And so I thought at that point when I was throwing up, it was just the flu or just something that I picked up at the game, food poisoning. And so I ended up going, and that whole night I was just feeling crappy, had the sweats, was throwing up every sip of water I drank, was trying to take medicine, would just throw that up. And so I was like, all right, I'll just sleep it off. The next morning I woke up with a 104-degree temperature and feeling the same way, and then I was taken to the St. Thomas Clinic where they did the initial blood test, and then they realized I had to go to the hospital from there.
Okay. How long did it take when you're in the hospital from the moment you got in to the moment they diagnosed you with cancer, and what treatments did you go under? Did you go?
Well, at first they had to get my temperature down and kind of control of all those symptoms, the headaches, the achiness. I even at one point had trouble breathing. I wasn't getting enough oxygen. So after a day and a half of kind of just getting my body pumped full of antibiotics, they started taking blood samples probably every half hour for 6 hours, and we're just doing constant testing on all that. And then they had it broken down to either I had some sort of serious disease that was in my blood or some serious blood infection, or then if it was leukemia. And so after like 2 days of testing, they officially diagnosed me with acute lymphoblastic leukemia.
What tests did they do?
I can't really tell you. It was just all sorts of blood tests and special testing. But then once they found out I had leukemia, to find out what kind of leukemia I had, they had to test my chromosomes from the bone marrow, because leukemia is cancer in the bone marrow. And so they did a bone marrow biopsy. So they had to numb up they do it in like the back hip right above my butt, and they go in there, and they numb up the area as much as possible, and then they have to pull out a sample of the bone marrow, and then that tells them what chromosome is being affected, and then that's the kind of leukemia you have.
Okay. What was treatment like, and how long did you have to receive it?
Well, I received treatments. I was in inpatient, so I was at the hospital for almost 5.5, 6 weeks, and there I went under a pediatric protocol for leukemia, and they put me on the study because they have better results curing kids with leukemia than they do adults, and so they're testing this middle age group, 21 to 30-year-olds, on the pediatric protocol to see how the results get. So I was getting chemo based on the week, once or twice a week, and I had what they call the PICC line. So I had a little surgery where there are two little like PICC lines and a vein that ran into one of the main veins in my system. And I would get either chemo from a drip bag, or they would inject it straight into the PICC line. I also would get chemo, through what they call the spinal tap, and where they get they'll get the spine fluid from my spine and tested for leukemia because that's where the leukemia likes to hide. So I'd get spinal fluids taken out and replaced with a type of chemo. Um, so I probably had chemo on average twice a week and went in once for labs just to check all my levels to see if I needed a blood or platelet transfusion.
Okay. Now that you're on the maintenance program, what has been the most difficult part for you?
The most difficult part is phasing back into real life. I've been kind of, sheltered and protected because I could get sick so easily. So now it's the hard part is getting back out there and feeling safe and not really feeling like, everything I touch is going to get me sick. So that's the hardest part. And then I've only had one treatment in the maintenance program, but that week you kind of feel the effects of the chemo, where you're just more tired than anything. You just kind of drained and you don't really want to do much. So that's the week you catch up on movies and TV.
Okay.